Odour Identification Test predict risk of Alzheimer's. By the time the patient starts losing memory, it's almost too late. That's because the Alzheimer's disease-associated damage to the brain have already been going on for more than 20 years. That is why there is so much scientific interest in finding ways to detect the presence of the disease in the early stage. Scientists now believe that a simple odour identification tests may help to track the progression of the disease, before symptoms actually appear, particularly among those at risk. Despite all the research in the area, no effective treatment has yet been found for Alzheimer's disease. But, if we can delay the onset of symptoms by just 5 years, we should be able to reduce the prevalence and severity of these symptoms by more than 50%. 300 people with an average age of 63, who are at risk of developing Alzheimer's disease, because they had a parent who had suffered from the disease, were asked to take multiple-choice scratch and sniff tests to identify scents as varied as bubble gum, gasoline or the smell of a lemon. 100 of them also volunteered to have regular lumbar punctures to measure the quantities of various Alzheimer's disease-related proteins whose presence in the cerebrospinal fluid. The researchers found that those with the most difficulty in identifying odors were those in whom other, purely biological indicators of Alzheimer's disease were most evident. Dr. John Brittner, the director of the Center for Studies on Prevention of Alzheimer's Disease at the Douglas Mental Health Research Center of McGill University, is one of the authors of the study. Marie-Lise Lafayette-Magnan, a doctoral student at McGill and the first author on the study. The study was published in the journal Neurology on 25 July 2017. This is the first time that anyone has been able to show clearly that the loss of the ability to identify smells is correlated with biological markers indicating the advance of the disease. For more than 30 years, scientists have been exploring the connection between memory loss and the difficulty that patients may have in identifying different odors. This makes sense because it's known that the olfactory bulb, involved with the sense of smell, and the entorhinal cortex, involved with memory and naming of odors, are among the first brain structures first to be affected by the disease. This means that a simple smell test may potentially be able to give us information about the progression of the disease that is similar to the much more invasive and expensive tests of the cerebrospinal fluid that are currently being used. However, problems identifying smells may be indicative of other medical conditions apart from Alzheimer's disease and so should not be substituted for the current tests. Promising findings suggests odor identification tests may help scientists track the evolution of the disease in persons at risk. The researchers caution that far more work needs to be done to see how changes in a persona TMS ability to identify smells over time relates to the progression of the disease itself. For the time being, smell tests are simply one more avenue to explore as researchers look for ways to identify the disease before the symptoms actually begin to appear. Thank you.